welcome to The Nest. I'm your host, Maureen Waititu, and here we speak about anything to do with human life, from when they are born up to when they leave this world. It's all about parenting as we learn from other parents or our specialists. And today's episode is special. We are talking about newborn hearing loss. Did you know actually 1 to 2 out of 1,000 newborns have significant hearing loss? Wow, let me tell you what I have learned with time. The test that is done to show how severe the hearing loss is just a quick couple of minutes procedure which takes place at your bedside, especially if you have a newborn. All you need to do is ask your doctor or the pediatrician to recommend an audiologist who will come in and just check on your newborn. An intervention would start taking place right then. So today we have a wonderful audiologist who is going to walk us through all these steps and to give you hope in case you have such an incident at home, whereby you'll be able to know exactly what to do to avoid it. Also what to do in case there is an incident where your child has a hearing loss. And we're also going to learn the difference between hearing loss and deafness. So do not go away. Watch this short video and we'll be right back.
Deafness is usually the result of inner ear or nerve damage. It may be caused by a congenital defect, injury, disease, certain medication, exposure to loud music, or age-related wear and tear. A person is said to have hearing loss if they are not able to hear as well as someone in normal hearing, meaning hearing thresholds of 20 dB or better in both ears. It can be mild, moderate, moderately severe, severe or profound, and can affect one or both ears. Research shows that about 1 to 2 in every 1,000 newborn babies has significant hearing loss. When a baby is born with hearing loss, it is called congenital hearing loss. Hearing loss can also develop later in babies. There are 3 main types of hearing loss: sensorineural, conductive, and mixed, which is both sensorineural and conductive. Some of the signs of hearing impairment in babies include not being startled by loud sounds, not turning towards a sound by approximately 6 months old, not saying single words like mama by the time he or she is 1 year old, turning their head only if they see someone but not if you call out their name, or seems to hear some but not all sounds. Hearing screening is easy and is not painful. In fact, babies are often asleep while being screened. It takes a very short time, usually only a few minutes. There are many kinds of tests an audiologist, who is someone trained to test hearing, can do to find out if the baby has hearing loss, how much of a hearing loss there is, and what type it is. Starting treatment as early as possible is the best way to go at it. On the show today, we talk to Dr. Isaack, wahome, who will dive in on this topic and help us understand it better.
Welcome back. And today we have a first. Mr. Isaack wahome, an audiologist. An audiologist is a person who is specially trained for hearing tests. And he's going to tell us all about newborn hearing tests, what can be done, the interventions around this tiny organ, which, by the way, we're going to learn the difference between newborn hearing test and adult or advanced hearing test and the differences it makes in each other's lives. However, the most important thing is to give you hope, to tell you that it's not really a disability. It's something you can live with and live a very successful, full life. Karibu sana.
Thank you very much.
Maybe you can introduce yourself to those who are just meeting you for the first time, like me.
Yeah.
Yes.
Yeah. So I'm Isaack wahome. I'm a clinical audiologist. That is the easiest reference that you can use.
Yes.
And an audiologist is somebody who basically studies the science of hearing and balance disorders. And they are here in the country, and their work is basically just to identify, diagnose, and rehabilitate children and adults who have hearing problems.
Okay.
Yes, it's as simple as that.
That's fantastic.
Yeah.
You know, earlier on when we were discussing, you know, behind the scenes, I was saying I wouldn't know where to start if
Yeah.
I needed an audiologist. In fact, a lot of people do not know about a specialist who deals with the ear, and we're going to get into that.
Sure.
But this tiny, tiny double organ,
Yes, yes.
maybe again, could you explain, other than hearing, what else it does to the body, and to show people the significance of taking care of their ears,
Correct.
and just taking it as serious as any other thing?
Yeah.
Yes.
So basically the ears they are anatomically set in a structural way that they are able, number one, to take direction of sounds. And the ear that you're seeing, you're only seeing the outer part of your ear.
Yes.
But from the outer part of the ear is just a fascinating, very complex, very well organized structure that is able to identify different sounds, different tones at different levels as they go through your ear. It's again, apart from just hearing, the ear is the one that gives us balance. I mean, like, it's the one that gives you balance to the left side, to the right side. So, and it coordinates efficiently with your eyes, your joints, your body, and so on.
Right.
So the two main functions of the eye, of the ears, is number one, balance. Number two is hearing.
Okay.
Of course, now we are misusing the ears with the mask.
Yes.
You're putting the mask behind there.
True.
Yeah, and
yes.
again, apart from that, we are having cosmetics. Yeah,
Yes.
you know, cosmetically, that's where we put our earrings and
Yes.
so on,
Yes.
our accessories and so on. So it's really a beauty in
Yes.
itself.
Yes.
And it gives you the shape.
Yes.
And the other thing that if you go to the villages, they talk about, if you want to know if this is your child, you look at the ears.
Oh,
so genetically, somehow we acquire some, you know, the shape and
Yes.
the structure from our parents.
Okay.
So that's how probably they look at your ear and they say, oh, you look like your dad, you look like your mom, and so
Wow,
on. So
okay.
yeah, there's that part.
So that's a you know, DNA testing in the
It's
village.
a village way of taking the DNA.
Yes,
Yeah.
yes.
Yeah.
And like some people, I think since South Africa, they
Yes.
take the kids to the cows.
Yes.
And if the cow does not behave in a certain way,
Yeah.
then it's definitely, the child belongs to the family.
Yeah.
My goodness.
Yeah.
Anyway, thank God for the DNA test that
Yes.
gives us almost 100% accuracy.
Yeah.
Ears, they come big, they come long,
Yes,
some tiny.
Many shapes. You know, we have bat ear shape. We have
Elephant.
those elephant
Yes,
ears.
yes.
We have those who are born without ears.
Oh.
They, I mean, like we call them, in a medical term, we call them microtia. They actually miss that part.
Wow.
Yes.
That's a real thing?
Yeah, I mean, like, it's a congenital disorder. There are people who, children or babies who are born without external parts of the ear, or even they have an external part, but the canal there is missing. There's no hole that directs sounds.
Goodness.
Yeah, so I mean, like, when you have your outer functional ears, you should
Yes.
thank God because of that. Because there are people who do not have, and they undergo quite a number of surgical procedures to make prosthetic ears. Yes.
My goodness.
Yes,
I
yes, yes.
honestly didn't think of it that way.
Yeah.
And it's normal, you know,
Yeah.
genetically, or rather when a child is being formed in the womb, for some parts not to develop, some even become multiple.
Yes.
And these are the things probably the outside world takes for granted.
Yes.
Because we haven't had such an experience.
True.
All right, so
Yeah.
let's discuss hearing testing
Yes.
in newborns.
Yes.
First of all, when does it start? How does it all start? Is it a wait and see, or is it a recommendation?
Okay.
Is it something developing now?
Okay.
Because when I gave birth 6 and 4 years ago, I wasn't told about the
About.
hearing test. So how does it come about?
And it makes sense. You're not an exceptional. There are so
Yes.
many people out there who do not understand about newborn. Now, just to start off, is, you know, when you're pregnant, at 18 months of your pregnancy, 18 weeks
Yes.
during pregnancy,
Yes.
your child is able to identify heartbeats.
Oh,
Yes.
okay.
And by the time you're 6 months, they're able now to identify sounds from the external, from away from your own body.
Right.
And in other words, hearing starts developing as early as possible. From 4 weeks, by 18 weeks, you have a fully sort of functional ear. And by the time you are term, you have hearing, or the ears developed as equal to an adult ear.
Right.
Now, when we talk about newborn hearing, hearing can develop either during pregnancy, after pregnancy, or during adulthood. You can develop hearing loss.
Okay.
So when we're talking about newborn hearing screening or newborn testing, we are talking about testing babies who are born from day 0, okay, up to 6 months.
Yes.
That is what we usually recognize as newborn.
Newborn, yes.
So, and during that time, there are so many things that takes place.
Okay.
You can lose your hearing either from maternal causes, it could be genetic causes,
Okay.
and probably we'll talk about that,
Yes, yes.
or infectious causes during that time, or a family history of hearing loss.
Yes.
So in essence, what you're doing is you want to know the newborn that you have, whether has a hearing or not.
Okay.
And if there's no hearing, then you can start intervention or rehabilitation early.
Early.
So the whole idea is just to screen. And
Okay.
it's a quick test that is usually done.
Okay.
There are 2 main tests that we usually do for
Okay.
newborns.
Okay.
It is non-invasive. It takes a couple of minutes for us to do it. It is not expensive. And it is usually done at the bedside. So you don't need to take somebody or a child far away. So it's something that can just be done at the bedside, takes a
okay.
couple of minutes.
Okay.
And the 2 main tests that we usually do, one we call autoacoustic emission, and the other one we call an ABR.
Okay.
And all of them are automated tests.
Okay,
So
okay.
what it does is that you put some probes in the ear, and the probes creates a clicking sound.
Yeah.
It's like a rattling sound.
Yes.
And it is measured at different levels, and it will tell whether a child is able to hear or not.
Okay.
So sometimes you might hear words like pass or refer when you're doing the hearing screening. So this is in essence the simplest way we can explain as newborn screening.
Okay.
You ask about the other issue, whether we have the services,
Yes.
whether it's something new.
Yes.
Global is not something new. You know, they usually say like 1 in 1,000 newborns or babies have a
Yes.
hearing loss.
Yes.
And these are statistics that have been done globally. There are so many research that has been done globally. And coming up home here, there are some studies that were done even in main hospital like Kenyatta on newborn
Yes.
and screening for newborn. Those services have already been started in most institutions, especially advanced institutions. And us as audiologists, we are advocating on the same,
Okay.
that we need to do newborn screening as quickly as possible.
Yes.
And going to the Ministry of Health, they have started integrating what we call ear and hearing care as early as possible
Right.
in all levels of hearing. And these are policies that are there,
Okay.
and they are starting to implement. So it's not something new.
Okay.
It's something that is ongoing. It's only that now we are telling parents out there,
Yes.
don't keep quiet.
Yes.
If you
Yes.
have a child or a newborn who has been born, mention that to your health worker that you want to do a hearing screening
Yes.
or a hearing test
Yes.
done to that newborn.
All right.
Yeah.
Because I feel like there should be more awareness.
Sure.
Especially when we do these prenatal clinics. It's good to encourage a parent,
Yes.
like when you give birth, ask for an audiologist to come in.
Yes.
It's just a little extra cost.
Yes.
Ask for maybe guidance on
Yes.
postpartum depression, because I feel like there's so much ignorance and assumption
Yes.
that the institutions that should take care of us, we frequently go there,
Yes.
but they don't tell us these
Yes,
things.
yes, yes.
Because if I have the information I have now, and I
yes.
got my babies, I would definitely ask, just for the sake of knowing on whether they have an issue or not. And we're
Yes.
going to come back to that
Yes.
in terms of what happens when your child has.
Yeah.
So let me take you back a little bit. there's also this African, I could call it African, myths and, stereotype that if a child is deaf, it must be your fault.
Yes.
Definitely there are those causes.
Yes.
So what are the major causes, especially the ones that are not so obvious, like genetics, infection and all that?
Okay.
Yes.
So yeah, the way we talk about hearing, we say it's an invisible disability. And it has a lot of stigma issues. If your child has a hearing problem, there's a lot of stigma related to that, and there's a lot of myths related to that. And one of the myths that is related, and I've seen that in my practice a lot, is that the fault goes to one parent, and majority of the time it goes to the mother. However, there are so many causes of hearing loss in newborns, from high risk to low risk. You can have a parent who has normal hearing, but their baby have a hearing loss. One of the main causes, which contributes to around 90%, is genetic. So it's either one or both parents who have a gene that can modify or can mutate and give a baby to have hearing loss. That is the commonest.
Wow.
And of course we have now infections, infections like CMV virus, which can be tested early.
Right.
And it just comes like a sore throat, fever, and swollen glands.
Yes.
We have infections like rubella, measles, toxoplasmosis during pregnancy. We have birth traumas. We have, especially for, where there's violence and those kind of things, or road traffic accidents, you can have birth injuries.
Yes.
The commonest I have seen in practice is what we call anoxia, when the baby is not able to, breathe enough oxygen during birth. So they are strangulated with oxygen.
Yes.
So they become anoxic. And there are conditions like cerebral palsy that accompanies that.
Yes.
So those kind of birth conditions can give you hearing loss. Now, the way we categorize hearing in newborns, we usually call one we call syndromic hearing loss and non-syndromic.
Okay.
So the non-syndromic, the child is perfectly okay, but has a hearing problem.
Okay.
But the syndromic ones are the ones they have like cranial or facial abnormalities. You can see the face is not well developed.
Yes.
Or and there are many. We have like Down syndrome, Treacher-Colley syndrome, Waardenburger syndrome, those kind of syndromes.
Yes.
So they have multiple deformities. Either joints are not formed or bones are not formed well. The heart is not working well in Down syndrome.
Yes.
And with that, they also have accompanying hearing loss. So for all the syndromic children or babies, you have to do a hearing test.
I see.
Now for non-syndromic, we usually say high risk. If those things I've talked about, jaundice, rheumatoid factors, incompatibilities, premature, the low birth weight.
Yes.
So if a child is born within that environment, with all those high risk things we are talking about, then those ones are mandatory. You have to do.
Okay.
If you have a family history of hearing loss, you have to do.
Yes.
Now, the other thing is that we start identifying hearing as early as possible. Usually a baby or a newborn will startle to loud sounds.
Okay.
They will startle.
Yes.
And as they grow up, by the time they are 6 months, they will move towards the direction where sound was coming from.
Yes.
And by the time they are 1 year, they will start saying one or two words, mama, baba, or something like that. So if you notice a deviation from this normal presentation, then that is there are signs that there could be a hearing loss.
Yes.
And one of the biggest impact of hearing loss is delayed speech and language development, which eventually will affect academics and social integration of this newborn.
Yes.
That's why we are saying it's always good to identify early so that you can rehabilitate early and they can come back to a community and integrate as early as possible with the kind of problem that they're having. Yes.
Oh, lovely. There I'm learning so much. And I like the fact that you've unpacked the high risk
Yes.
factors
Yes.
that even if a doctor does not ask,
Yes.
you need to go back and say, hey,
Yes.
with this jaundice,
Yes.
maybe cause
Yeah.
hearing loss.
Yeah.
I had birth trauma,
Yes.
or I had pregnancy trauma.
Yes.
So I think it's so important for the information to be out there.
Correct.
Because I feel very sad, especially when I hear the word mandatory,
Yes.
because my firstborn son had severe jaundice,
Yes.
and it was not,
Not done.
nothing was done.
Yeah.
And to be fair, he developed some neurological issues later,
Yes.
which it came from my maternal instinct,
Yes.
but not knowledge.
Yes.
And again, if I
Yes.
knew earlier,
You will do that.
I could have taken care of
Yes.
some of those things. But thank God he's fine now.
And the reason is, you know,
Yes.
our health system is usually overwhelmed.
Yes.
I mean, like, we have so many issues to handle. We have, you know, infectious issues. We have lack of human resource,
Yes.
lack of equipment,
Yes.
lack of personnel and
Yes.
specializations.
Yes.
I mean, like the doctors, the nurses out there, they're really trying hard
Yeah.
to cope up. And
Yes.
we, we are sitting in this discussion, we want to take and roll the ball back
Yes.
to, you know,
Yes.
the population. Like, you need to take charge of your health.
Yes.
You need to identify the risk causes. If a child has developed meningitis after delivery,
True.
meningitis can cause hearing loss.
Yes.
If you're taking certain medications, like especially gentamicin, over the counter mostly, you know, anti-TBs, medicine that can cause hearing loss. You need to identify them,
Okay.
which medication. You need to know exactly what medications you're taking, what
okay.
your baby is being given.
Right.
Can it cause hearing loss?
Yes.
And can it be monitored? Because we usually monitor so that you treat the infection, but you don't cause another problem.
True,
Yes,
true,
yes,
true.
Yes, yes.
Wow, so far so good.
Yeah.
We've tackled causes
Yes.
and the newborn testing, and I
Yes.
will slightly go back to newborn testing out of curiosity.
Yes.
However, actually, let me start with that.
Yes.
So the testing itself,
Yes.
and you've said there are two types of non-invasive testing.
Yes, yes, yes.
So I don't want to underestimate newborns,
Yes.
but this little guy is all they do is sleep and cry.
Yes, yes, yes.
So I mean, as an audiologist, how does it really work for you to know whether they responded to a
Yes.
set? Because I've done a hearing test,
Yes.
and I was thinking, how will kids say, yes, I can hear that?
Yeah,
so
yeah,
how
yeah,
does
yeah.
it work?
Yeah. So
Yeah.
the way we do hearing tests for newborns and adults is totally different. So for newborn, we usually use automated equipment.
Okay.
One of them, and very common, is called an autoacoustic emission device.
Okay.
So it's a simple device,
yes.
and then we just put a probe inside the ear.
Okay.
And we usually like when babies are sleeping, like you said, and they're quiet and in a quiet environment.
Yes.
So the probe goes inside there, and then it has like 4 clicks, 4 to 6 clicks, and within seconds, it will tell you whether a child is able to hear or not.
Okay.
Now, remember the way hearing takes place.
Yes.
So we have the outer part, which basically you see the ear on the outside, and then we have the canal,
Yes.
where it's like a funnel that channels sounds to the eardrum. And then inside there, we have the eardrum, which vibrates back and forth. And between the eardrum and where we have the cochlea, there's a middle part, what we call the middle ear, that has some small bones. They are called ossicles.
Yes.
So very well arranged, 3 bones,
Yes.
and they also vibrate together with the eardrum,
Ah.
and they transmit now sounds to the cochlea.
Okay.
So these autoacoustic emissions, they are able to test the outer part of the ear,
Okay.
the middle part of the ear, and now the
inner
cochlea.
part. Okay.
The cochlea is that snail-shaped
Yes, yes,
structure.
yes.
That part of it has fluid,
Yes.
and part of it has the nerve endings
Yes.
that take sounds to the brain.
Okay.
So this equipment, when you put there, it is able to transmit sounds across all that level. So if there is a problem at any level,
Yes.
maybe at the ear canal level,
Yes, yes.
the obstruction with
Yes.
wax or just fluid
yes.
during delivery,
Yes.
what we call vernix,
Yes.
or middle ear fluid,
Yes.
you are able to identify that, and you are able to treat that early.
It sounds so complex.
Yeah.
Yes.
And then the other equipment is able to test now that from the outer part to the middle part, and then again it tests now the cochlea and the nerve.
Okay.
So the nerve that transmits sounds to the brain. That is what we call an ABR equipment. So those are the two commonest screening for newborns.
Okay.
And you just need it's usually done when the baby is asleep and
yeah.
is not crying.
Okay.
So sometimes you might test 1 ear today, the next day, because
okay.
you want it
you have to take to be sure,
yeah,
and you want it to be an easy process.
an easy process.
Right.
And it takes a couple of minutes. It doesn't take long.
Okay.
Yeah.
So the babies get startled, or
no, they don't.
so there's, like you said, it's automated.
It's
so it shows
automated.
you in terms of numbers
Yes.
and all that.
And then it gives you the results. So the results are either a pass. So a pass means that the child is able to hear.
Yes.
A refer, it means that there's a problem.
Okay.
And if there's a problem, then the audiologist needs to do further diagnostic testing.
Absolutely.
It's a very easy test.
Yes.
So for mothers, we are given a piece of paper
Yes.
or an information. You're told your
Yes.
child has passed hearing screening.
Yes.
Or your child has failed a hearing screening, and therefore you'll need further examination done. So it's a very simple test.
Yeah.
Yes.
Wow. I in my head it sounded so complex
Yeah.
until you really unpacked it, and I was
Yes.
very curious.
Yes.
So we're going to take a short break.
Oh.
And then we're going to come back and tackle the difference
Okay.
between hearing and deafness, because I feel like there's a lot of misconception around that.
Correct.
All right.
Yeah.
So, guys, so far it's been such an amazing conversation with Isaack Wahome, a clinical audiologist who specializes in hearing tests and also solutions towards it. I'm learning so much about newborn hearing tests. I thought it was, very complex and all that until he broke it down to me, and I'm thinking, wow, if I knew what I know right now, I could have done it for my babies. But thank God they're fine, and I hope that you at home are learning something today, the causes, the symptoms, what you should look out for, and also to realize that as we go to the second part, it doesn't matter what your hearing loss looks like. You can still lead a very productive life, and he's going to give us a few examples of successful people who've been able to do that, and also the early interventions and exactly where to go. Do not touch that dial. We'll be right back after this break.